and you're waking up to a health alert. All across our nation, medical professionals are seeing a massive spike in COVID and flu cases. And there's a reason behind that. Let's talk it out with the help of Dr. William Schaffner. Doctor, thank you for being here. And I know you've had high-profile positions in the past concerning infectious disease, so you're the perfect person for us to talk to about this. Sounds like vaccination rates are lagging, and that's what's leading to these COVID and flu cases rising. Do I have that right?
Well, you're certainly right, Kim. We haven't vaccinated enough people. It's rather late to get your vaccination now, but we all ought to make a resolution to get vaccinated again this fall when all of this starts over again. But yes, we're seeing many cases of flu and some of COVID coming into our hospitals at the moment, most unvaccinated.
A couple of things. It's not too late then to go stick your arm out at a local drugstore today and get a vaccination. And can you get COVID and flu vaccines together?
You can get them both together, and I would run, not walk. But these viruses are going to be with us through February and into March. So if you haven't become ill yet, go ahead, roll up both sleeves and get those vaccines as quickly as possible.
And doctor, you are well aware of the current climate, and some people now that never were worried in the past are concerned about getting vaccinated, but there are other ways that you can protect yourself without getting a vaccination, correct?
Well, sure, you can social distance. Now's the time to stream a movie rather than going to the movie, because going out among crowds indoors is the way to pick up this infection. And if you do go out, put on your mask again. It's very useful in preventing your acquiring an infection. And of course, if you do become sick, please immediately call your healthcare provider, because we have antiviral medications that can reduce the severity of your illness. But you have to do that promptly in order for those antiviral medications to work very well.
Doctor, I want to talk about what we're expecting to see on the Hill today, and that is hearings for Robert Kennedy Jr., who for years on end was a well-known anti-vaxxer. Now they're holding hearings for him to become our Health and Human Services Secretary. Are you concerned about a person like that in that position of power?
Well, Kim, I don't talk about political things, but I do talk about vaccines, and they are very, very good, and also the antiviral medications that we use for treatment. If we emphasize the vaccines and the antivirals, we'll be in much better shape.
And before we let you go, we just talked about the price of eggs that are already up some 40% from what we were paying years ago and could go up another 20% this year in 2025. And it's because of bird flu. Do we need to be concerned about contracting bird flu?
Well, fortunately, those bird flu viruses have not yet picked up the capacity to spread readily from person to person. So we're watching that very closely, but that's not the issue for the average person. Right now, the issue is real flu, seasonal flu, and COVID. Get those vaccines, and if you become sick, call your healthcare provider and get that antiviral treatment, which will reduce the severity of your illness.
Very important discussion. Thank you, Dr. William Schaffner, for your time, and thank you for getting the word out. Our health and making sure the community stays healthy, obviously of big import. Thank you.